And what I'm going to say to those folks is, yes, there are some elements that are really helpful, but do we really want to do that in an open platform that's not monitored? There are no guardrails today. Do we not want to do that in a more secure environment? So that's just a question that we have to ask ourselves. Even if we're anonymizing this information and just kind of, which I do myself, I am one of the DIY testers. I am my own guinea pig. I think that's just the nature of some of the, folks out there that always want to test and validate what we're doing. There are a few things that stand out. One, I've caught the AI hallucinating multiple times. We need to remember that. It still hallucinates, even the best and latest version, if you have access to GPT-5 or all of the latest AI.
Welcome to the Precision Medicine Made Simple podcast, where we simplify the complex world of precision medicine. We're here to explore how personalized healthcare can empower you to understand and improve your health to live a longer and healthier life. Join us as we break down the latest in medical science into actionable insights. Let's make precision medicine accessible and actionable for everyone. This episode is sponsored by Biography Health, where DNA-powered healthcare is designed just for you. Biography Health is a HIPAA-compliant precision medicine platform that equips providers with AI-driven recommendations powered by your genetics, health history, and clinical insights, all while keeping data private, secure, and independent from large EHR systems. If you're a provider ready to bring precision medicine into your practice, visit biographyhealth.com to learn more. Or if you're a patient who wants your doctor to explore this, point them our way. We'll help them bring personalized healthcare to life. As a reminder, this episode is for educational purposes only. This episode is in no way a replacement for professional health advice. Please consult with your professional primary care provider for medical advice. If at any point you feel that a topic discussed on our podcast was misrepresented, or if you have additional insights that could enhance our discussions, we wholeheartedly encourage you to reach out to us. Your feedback is invaluable in helping us improve and in ensuring our content remains both informative and reflective of the latest developments in precision medicine. Hey everybody, welcome to the Precision Medicine Made Simple podcast. I am not joined with my co-host here, Dr. Stanford, but I am joined with Lucy Janoyan, who is also the Chief Operations Officer over at Biography Health, Chief Strategy Officer. And so for us, we recently just came back with our CEO, Bill Turpin, from Rosetta Fest. And so we wanted to go through just some thoughts about it, because I think I had some pretty strong epiphanies from there. But then also talking about the landscape of the DIY culture of healthcare and where it stands. And then also even managing families' healthcare and what it feels like, even just like as from a patient perspective, and caring deeply about our loved ones and making sure that they have the best healthcare too. So Lucy, welcome back to the show. You've been here a couple times. Let's dive right into it. Rosetta Fest.
It's good to be back. Yes, let's
Yeah.
do it. What did you think?
Okay, let's see. Let me take a step back. So like as we were walking out, I was throughout the entire conference, I mean, there was a mix of a lot of different people there. There were employers, insurance plans, there's also a mix of providers there too. And I was honestly not coming from like a very strong healthcare background. I haven't been in healthcare for that long, but as I was trying to put the pieces together, I just felt like it was so unnecessarily complicated to actually try and provide the best care possible. In considering how many hands were in the pot and figuring out who gets paid, and everyone's just trying to cut costs, and there's not a lot of transparency when it comes to healthcare costs. It seems like there's so many middlemen
Yes.
that really prevents us to like try and give personalized care or the best healthcare to just the broader population, just in general. Um, that was pretty mind-blowing for me, because I also was trying to understand all these different acronyms too. So many acronyms that I just didn't understand that I needed to look up.
And we have new ones. I have to keep up with the acronyms, and I've been in healthcare for a very long time. And I do think it was a very astute observation on your part, Taylor. Granted, the short amount of time you got exposure to these different entities, and for everyone on the call, Rosetta Fest, actually one of their objectives is to simplify the process and to ensure that some of these complexities are reduced, so we're not paying for that. But I do think there was a good theme, and even with Chris Deacon, uh, she just published a book called The Big Healthcare Heist and The Great American Healthcare Heist, sitting on my desk. But it's about costs and transparency. And I think that one of the big themes that I saw there was cost and transparency in employer health plans. Of course, we know that a lot of employers also are self insured, but how do employers and benefit advisors who were present at this conference redesign plans to, like you said, reduce that waste, improve outcomes, gain the visibility into what's driving costs for everyone, for our employers, for us as employees, as the consumers of health services, and opening that data, right? Opening and sharing data. And like you said, removing middlemen is very, very important. And removing that unnecessary complexity to focus on things that are fixable, at least for the time being. But we know that the infrastructure is so convoluted, it's so complex that it will take quite a bit of time to undo that. And it has to be done at the policy level. I know you and I talked briefly about the Deloitte report that just came out and how much money the system can save, literally trillions of dollars per year, if we were to truly focus on preventive and proactive care, which is one of our pillars here at Biography Health. And a lot of companies are trying to do that. Um, but also looking at some of the other levers, I think another lever that was talked about at the conference, it was from kind of the MSK or musculoskeletal care perspective. There were, like physical therapy, for instance, but I think it applies to a lot of digital tools, digital health, direct to consumer platforms. But what it turns out that a lot of communities are now wanting this in person, local provider care in addition to those tools that are available, because just the tools themselves are not sufficient. And I do want to get into that a little bit because I do believe that hybrid platforms such as Biography Health and how we deliver our services, our product through the physician offices really meets this objective. And there are organizations that are doing that within their own specialties, which I appreciate, because at the end of the day, again, it's we have trusted providers within our care team, and we cannot forget about them even with all the coolest and best gadgets that are available to us. Another aspect that I thought was interesting at the Rosetta Fest was just kind of employer direct contracting. I saw a lot of these networks were being built within these kind of DPC domains, direct primary care domains. Advanced primary care was also, which is kind of a newer model that was rolled out, was topic of conversation. So we're seeing networks and ecosystems being built, and all of these organizations coming together, being connected through these networks of employers, advisors, um, and just really a cross pollination of stakeholders. The different policymakers, health companies, and so on and so forth. So it was really a great place to see that happening, that unified approach to change that is incredibly necessary for our healthcare system. And it's really the folks in the front lines that are paying the highest cost that are trying to do this right now.
There is, well, since you mentioned employers and wanting to dive into this more, and just to make sure that I also have a better understanding of this too, because I think this also leads into what we wanted to talk about with where the DIY kind of came into place is there seems to be just a strong level of distrust when it comes, at least like my intuition is there's a little bit of a distrust when it comes to like healthcare plans and like providing healthcare, I guess, data to, let's say, their employers and knowing to how to be preventive. There's one comment that was made, and it was in a conversation where it's like, "Oh, if this patient does go through genetic testing, we could actually use that to help underwrite insurance."
I hear that. That was ooh.
And
That makes me
and
nervous.
it makes me nervous, but then also, like, knowing that now, even from an employer standpoint, they could use that information to then now dictate how you're gonna be I kn yeah, sure, there's certain rules that are out there, but I mean, even it just in the, intention with, like, using that, it can potentially be used against you, that doesn't make me as a patient feel very great to know that, yeah, my employer might have all this information potentially, and that could dictate my future on if I'm gonna be able to get employed later on, and if insurance is gonna be even more expensive than I actually can afford, even though that I could be getting the best care possible. So, like, that level of distrust and knowing where data could be in the wrong hands, I
Mhm.
think has also created this movement of, let me just try and figure it out on my own, and now insert all of these other do it yourself companies, and why people are trying to lean into AI and do it themselves is because there is that level of distrust that's kind of come along the way.
There is, but if we think about if you think about the average number of times an employee changes companies and health plans, and every time they join a new organization, new company, or a health plan, their data set gets really locked in with that organization or company. So essentially, there is a fragmented map of all of our PHI sitting with multiple employers from the past. There will be in the future, multiple health plans, multiple medical records, multiple charts, and we cannot even access all of them. Right? There's no way. I can give you an example. With women, 80% of women take care of all of their family members' health, whether it's, the sandwich generation of women for their parents and their children, um, or just, proactive, taking care of the needs of the family, um, maybe just parents or just kids. But if we're thinking about managing the data sets across all the different platforms, well, if we're saying we don't trust it, but at the same time we're still willing to go in and, you know, they have our information. So we still go and see that doctor with a different health plan, and then we switch over and go see another doctor if we can't keep that health plan. Now our information is spread out. So if I go the DPC route, if I go and now they do verification. They require licenses and IDs when you're ordering prescriptions online. So that information is sitting with those DPC companies, even if you're paying cash. Regardless, if it's a prescription, if it's a prescribed medication, cream, whatever you're ordering, they have all of your information, um, and then you can it's all specialty DPC, so you're moving from specialty to specialty. So I just found it interesting whenever we talk about trust. At the end of the day, I think we will do what we think is best for our health and trying to get as much information as possible. It's not an efficient way. I do think that in this fragmented space of health system, DPC, and everything in between, we're as the healthcare uh, consumers, we're the losers in a sense that it's really difficult for us to manage all of that information. Of course, that's what companies like Biography are trying to address, all information in one place so we can digest, synthesize, and really see those trends, right, over time. But I can tell you, um, I've been trying to. So if we switch gears here, I'm just gonna quickly switching to the DPC um, versus a trusted care team member. So for some of us, I think there are a lot of sophisticated folks out there that are reading, learning. They really have the ability to take information and be able to process that to benefit themselves. But what are the limits, right? I think a lot of people feel that, oh, now I have AI, I can access Chat GPT or different LLM models, and um, I can do some of this myself, right? I'm going to go and hunt down all of my medical records and information. And what I'm going to say to those folks is, yes, there are some elements that are really helpful, but do we really want to do that in an open platform that's not monitored? There are no guardrails today. Do we not want to do that in a more secure environment? So that's just a question that we have to ask ourselves. Even if we're anonymizing this information and just kind of, which I do myself, I am one of the DIY testers. I am my own guinea pig. I think that's just the nature of some of the folks out there that always want to test and validate what we're doing. But there are a few things that stand out. One, I've caught the AI hallucinating multiple times. So we need to remember that. It still hallucinates, even the best and latest version, if you have access to GPT-5 or all of the latest AI. So we need the providers, we need the experts to validate that data. If, especially if that's not our domain of knowledge. And two, uh, the AI is going to use available information, different references. But I do some DIY health tracking myself. And I recently shared this with my trainer at the gym who's known me for a couple of years. And I was very proud of myself, telling her how I track my macros now and I'm better at it and I'm weighing everything. And she was asking me about my protein intake. And it turns out I'm way off base with my protein intake because what she's recommending and what is recommended out there are very different um, for what she thinks I need, right? And what AI thinks I need. So I think we want to keep that in mind. And I'm going to do a little experiment that I'd like for us to track here. One of the best features of Biography Health is that we can access nutrition and fitness reports. And these are amazing because they will tell us about how we metabolize certain foods and micronutrients and what will work for us and what won't, and how we respond to certain types of fitness and how we build and retain muscle. Just a wealth of information. And I'm going to try and use AI as my coach to digest and make a plan, and then compare that to what my health system doctor suggests with this information versus my trainer suggests with this information versus my concierge precision medicine doctor suggests with this information. And I'm just really curious how much congruency we will have, what parallels, right? And what's going to be off, what discrepancies we'll find in how the different care team members view this data and want us to apply it in our daily lives. At the end of the day, it's how we apply this information that will impact our health. It's not just having this information that just sits there and does nothing, right? Collecting digital dust. So
Yeah.
it's exciting to even be able to do that.
Yeah, well, and I mean, thank you for also like doing this experiment too, because I'm very excited just to follow along and see the results of what comes in it and seeing the, sort of the discrepancies between the 2. But I think it paints a pretty good picture of just more data does not always equal better. Because I mean, if we think about it, like, there's so much information and data as it is. If we don't really know what to do with the data, I mean, it's kind of useless
Yes.
then, unless there's, like, any action or direction. And I think that's also why, I mean, there's some companies out there that are DIY, and you get results and you don't really know what to do with it then, and you're like, "Okay, I'm gonna try this and try that and kind of see if this works," which I think is great because I mean, we even had another podcast guest talk about how we should be running our own experiments on ourselves and then
Yes.
continuing to track and better ourselves and optimize performance and all that. But there's in a way, it really is a team effort with plenty of different resources to our, um in our toolbox. One one thing that I was thinking about though, when you mentioned like nutrition and fitness though, is like when it comes to like genetics, I mean, how am I gonna paint this picture? Genetics is like the foundation because like I think with before I started learning about genetics and like trying to um I really just wanted to try and be healthy and I would go based on my nutrition and really try and eat well. I would exercise just based on, what Michael Jordan does just because I wanted to be a superstar at the
Yeah.
time, right? But then I also realized, like, there's not r it's yeah, I'm running my own experiment, but how much cooler would it be if I had a strong solid foundation of, this is how my body actually reacts to certain things, and this is also, like, what I'm predisposed to. Let's try and get ahead of it, have a strong foundation, and now fix these lifestyle factors so I can perform and get the best care.
I think it's especially important for young athletes or young aspiring athletes. How many injuries do we hear of? Of course, there are the rare outlier cases of young athletes just dropping from some sort of a heart condition, which is incredibly tragic because it could be prevented if they had the knowledge of that condition. And we do that. But on the practical side, if we're prone to certain injuries, there are genotypes that we have. We will know. For instance, I'll give you an example. When I like to go on full incline on a treadmill, but every time I do that, I have a lot of pain in my Achilles heel. And I never really understood that. I thought if I did more stretching, or maybe I wasn't doing something right, or I kept changing shoes, maybe it's my shoes. Well, it turns out I have a genotype for that. And I'm
Hmm.
prone to that injury. And according to this report, I have to be careful and not push myself when I feel that pain because I will definitely injure myself. So now I've changed the way I get on a treadmill. And if I get any kind of a signal, I know to stop or modify or lower the incline because I'm aware of that. And how powerful is that to have that knowledge?
Knowledge is power. What I think gets folks though, and even I was in the mindset too, especially when it comes to trying like to invest in our own healthcare, is that I don't want to invest time and money for information I might already know. Like like the generic, like, oh yeah, everyone should just eat a Mediterranean diet, walk 10,000 steps. Like that's all. And I think it's a pretty common concern just all across the board. Cause I mean, I've even heard it amongst my family members that didn't necessarily want to go through whole genome sequencing, where it's like, okay, yeah, I'm going to know this, but is it just going to tell me to get 8 hours of sleep? Cause there's no way that's going to happen. Right. And so the, I mean, but I could see the power though, and like how we can get more specific in looking at what actually works for us, like within our reports and stuff. Or actually, like, I think also knowing that something isn't affecting us. I'm kind of going on a tangent here. I kind of lost my I lost my train of thought, to be quite honest.
Well, I think going back to talking about, all right, we have our genome sequence, we have all this information. What does that really mean in our daily lives, right? We're talking about epigenomics, and we're talking about the ability to impact our destiny, because our genetics aren't our destiny. And we say this to all of our patients, right? On our platform, when they get the reports from their physicians, your genes are not your destiny. Don't be alarmed. I think it's really important to keep that in mind, even if certain risks are much higher than we anticipated to be. I went through that, and there are steps to be taken. There are tests that can be done. There are ways to ensure that we're monitoring, and we're the best advocates for our own health. We always tell nowadays students are encouraged to be self advocates in the school, just like patients are encouraged to be advocates for their own health. And doctors love that. Doctors love patients who are in the passenger seat with them, right? Or even the driver's seat, and they want to have the medical coach right next to them along the way, because an average doctor, primary care, if you have one, a lot of people don't even have a primary care doctor, does not have the time to sit there and analyze this information and give you a blueprint. Most of our doctors, they care, they want you to be well. They want to be you to be healthy, but they need us to also carry our weight a little bit and make those lifestyle changes. If a doctor says you need to be eating healthier, how do we translate that? Is the question. That's where Biography Health comes in. What does healthy mean for me? Let's unpack that a little bit, right? And that's what I like to get into, part two of this call. What does that mean exactly when you tell me healthy? Because healthy means something different for me, means something different for Taylor, and someone else. So there are some uniform good, really good advice that doctors can tell you. You need to have better quality of sleep, you need to have better nutrition, you need to move more, you need to exercise more, and those are all true. Universally speaking, that's all good advice and it's true, but we're human, and unless we have some specifics, human behavior doesn't change that easily, right? And how do we engage the patient? How do we engage that human that has a hard time keeping their attention on something, because we live in a very distracted world? How do we do something consistently? That's the key, because you may be doing exactly what you're supposed to be doing to live to 125, but you can't keep it up for that, next 20 years. Because we have a hard time doing that. My trainer was telling me she looked really great, and I said, "Oh, you must be working out more." She said, "Yes, but I've been eating donuts this summer, and I need to." Right? So no one's perfect. Our doctors, our trainers, our scientists, we all go off track. We know it's not good. We know we shouldn't have that slice of pizza, and we justify it by saying, "Well, I don't eat it every day. I don't have this all the time, so it's okay for me to." And we say this, it's okay for us to cheat and have cheat days, but um, that's fine as long as it's not you're consistently cheating, right? On your healthy behaviors. So I think at the end of the day, what a successful platform, care team, DIY method will do is to give us that consistency and being able to really change our behaviors. And that's when we can see some amazing changes, because changes take time. They're incremental. They they sometimes they will take years, and we just don't have the patience for it, right?
Yeah.
The younger we are, the less patience we have for that.
We want the immediate gratification.
Yes.
Yeah. You mentioned something when you mentioned that there's just like a number of different people that's in this process. I mean, there's so many different resources. You mentioned that you have your coach and your trainer. Um, and I think I want to emphasize and also ask you a question on your end, because you shared before we hopped on this podcast, you shared a pretty alarming not alarm well, it's not alarming, it's actually really fascinating to know about managing family healthcare just in general. And so I would love to get your perspective because I mean, you've had a background in healthcare for many, many years. For the people that are listening that don't have a background in healthcare, how could they still help manage their family's healthcare and then also try and find these trusted resources and build their trusted care team to help them have the best care possible?
Absolutely. I think look, and you and I were comparing epic charts, right? I have 3 different epic charts on my phone. They're from different health systems, depending on my time with whichever organization. Um, and then I have that's just for me and my family. You mean, and then I have multiple charts for my mom. They sit across different healthcare systems. If I want to get something from radiology or um, from Quest Labs, wherever their doctors are sending. And it's difficult. You again, going back to self advocacy, I had to convince her physician to always order labs from the same place because I want to see tracking and trending. I want to see what's happening over time. Um, because that's how we're going to be able to intervene, prevent, delay the disease transitions, or even reverse some of them. But it's incredibly challenging. A small physician practice may have their own lab that they want to use that has no system set up. Everything, you may not even get the results until they decide it's time to call you. So for individuals like my mom, they stand no chance unless they have somebody like me navigating for them. And it's really scary. Then we wonder why we have a nation where we're spending trillions of dollars on chronic care conditions because the system is so incredibly fragmented that yeah, she's on her smartphone, she's navigating through everything else, she's fine on social media. She can connect with her friends and do all sorts of things. But when it comes to accessing and keeping track of 18 different passwords, not her strong suit, right? And we've developed our own methods of, well, I need to keep track of 160 passwords and make sure they're secure and I don't get hacked. And make sure that everybody else doesn't get hacked. And that gets exhausting because that's when we miss things, right? So again, going back to having one system, one platform to pull all of that information in, even if I have different providers, even if I am going to different healthcare systems over time, I can still house everything. Today, I house everything in Biography. Today, I know that I can access my care information in there, whether it's genetic reports, labs, any kind of radiology reports. A lot of it is preventive diagnostics, and keeping this in one place that I can access. So when I do go to another provider, I can share it with them. Um, but I also know that it's not going anywhere else unless I choose to share it with them.
Hmm.
So I think that's where we're moving towards. We're moving towards more holistic care, but that's also very consolidated. There are individuals who can stay, maybe they can stay in one health system, and that would be done through their Epic chart. If they use the same doctor from the health system as the laboratory, as radiology, but it's not always the case. It really that's not reality. I think that's more of the minority of folks that are able to access healthcare that way, especially in rural communities. It's really really challenging, really challenging.
Do you know the history of how we kind of got here to all this different fragmentation and different silos within healthcare? Like, why is everything so separate?
Because it's not government healthcare, right? It's private.
Hmm.
So
Okay.
anytime you're in a capital society, capital system, you're gonna have it's a double-edged sword because we have on one hand, we have the best medications coming out of the US, the best pharma, the best innovations, best technology, really the best of the best. We're trailblazing, we're innovating. There's a cost to that. It's very high cost to continue to innovate. All of the research that was being done through whether it's nonprofit organizations, academic institutions, and that information flowing through these private organizations, even if we look at the private market today of all of the startups, I mean, these startups are doing amazing things, including Biography Health. Um, but that's why it's fragmented because you know, if Epic started out as essentially a billing system to help hospital and healthcare organizations, and it has really morphed into this comprehensive EMR, although I still think it's very archaic. But there's continued improvement and a lot of customization, but it's being customized for a region, for a small system, a large system, um, and that's just private healthcare for you. So you would see there are countries where they have more centralized social healthcare systems. You don't have as much fragmentation, but you also don't have as much innovation. So how do you come together and have the best of both worlds? That's the problem to solve.
I have another question now, speaking, well, more about insurance then. And because the traditional model of insurance, right, is where, well, I mean, in health insurance is like I work for a company and then they give me benefits and I typically have health insurance with a specific network, right? But then I don't know if it's just recently, and please correct me if I'm wrong, but maybe as of like maybe as of, I don't know, maybe past couple years, I've started to see a lot more like self-insured employers
Yeah.
coming out. Is that always been around, or is that going to be a growing trend for these larger employers to then pay insurance themselves? Well, are isn't it kind of the same if they're paying insurance?
No,
But
it's a growing trend. Self-insured employers. There are many reasons for that. Starting with visibility into utilization and understanding the cost structures and having more kind of flexibility and creativity and how healthcare resources are deployed within the organization or priced out. Sometimes it's just by way of necessity because the organization just cannot afford to go and buy the products that are available through the brokers and through that market. I would say, look, insurance started out. Insurance Healthcare insurance was really just employee insurance back in the days for the unions to appease because what was happening in the industrial age and in the factories is these employees were getting hurt or sick and it was a huge liability. So one way to attract those employees was to have this kind of insurance system to ensure that they can keep them working and that they would give them access to care. So it was really primarily for keeping those employees in the factories, and then with CMS and having insurance that kicks in when you're 65. The model is not built for people that live into their 80s. The reason it started at 65 is because most people didn't make it to 65. That was the whole point. So now we have an incredibly burdened, system for folks 65 and plus because they're living much longer, albeit with comorbidities and chronic disease that's costing us trillions of dollars. But that's kind of the history of where number one, employer sponsored insurance came and from it wasn't very altruistic, and also why we have government funded insurance like Medicare starting at the age of 65. And there has been, of course, conversation about changing that, right? Changing the age of
Hmm.
when that kicks in because people live longer.
It's starting to click a little bit more. And it's also because I could see the benefit, right? With insurance, it's like when something does happen, you want to be able to make sure you're protected just in case. But now I see why it's turned to this sort of reactive healthcare system because I mean, insurance, I mean, right now doesn't pay for well, mostly doesn't pay for like, let's say, whole genome sequencing or any type of preventive solutions then, right?
No, but employer see, that's the benefit of the employer sponsored because in employer sponsored plans, they can be creative and provide access to
Something like
innovative testing, diagnostics, and care. There are employers that pay for Grail, for instance, which is the cancer detection test that you can do once a year. It's per use, right? So it's if I choose to get a Grail test, they will cover it. But I do think in the future, if employers are paying for in vitro fertilization. They're paying for all sorts of services to ensure that their employees are just at least not worrying about that, and they get some of that stress removed. They get access to mental health care through their employers. So I think there are a lot of great things happening with organizations that care about their employees' health, and I do think that continues to. Um, at least for some employers and employees, it gets better and better, those offerings and the wellness investments that they're making, but not everybody can afford that. The small employer cannot afford that. So how do we design services, products, reimbursement, policy change so it's not just available to the wealthiest organizations or the wealthiest people? How do we democratize access?
and that adds a whole 'nother layer of complexity when you're designing it for these smaller employers, because we can't just tell the smaller employers to step their game up and just make more money. I'm just kidding.
Right.
But, like,
Right.
yeah.
It's hard. It's difficult for some of these smaller companies and startups. So and there are trade-offs, right? I think always found it ironic when my first role at Kaiser Permanente, I had free health insurance, but I was like the perfect employee to have free health insurance because I never utilized it. When you're in your 20s, you don't even go to the doctor. Like, I don't need a doctor. I'm perfectly healthy. I'm fine. Right? So you have almost zero utilization, but healthcare is covered. So yes, I think Kaiser Permanente is fantastic for the younger population in terms of insurance, right?
Hmm.
Just in case something happens, God forbid, they're there and they can really take care of you. But it's you're healthy, so that also reduces the risk on their side. I can
Man.
see your gears turning, Taylor.
Yeah, yeah,
You
yeah.
have so many thoughts and questions.
I mean, we could go on because I mean, I feel like the more conversations I have, the more it starts to click, but even then, it's still
Yes. Yeah.
there's still some ambiguity that I'm trying to still sift through and reflect on and make sure I'm a little bit more clear.
We need to compare our nutrition fitness reports offline. I'm curious. Uh,
Yeah,
when you get yours, you're doing a different one, right? You did the whole genome. Are you going through getting the nutrition and fitness ones as well? The recent.
yeah.
Okay, good.
Yeah. So, when I do get that back, we can definitely compare,
Yes, it would be
for the
fun.
next episode.
Yes, yes,
Cool.
that'll be great.
Awesome. Well, is there anything else that you wanted to talk through, Lucy? I think we
I
talked
think
through
we've
quite a bit of
covered so much,
topics.
and this was really just an open conversation, and you know, a, based off of conversations and discussions that were happening at just kind of to bring it full circle at Rosetta Fest, Hint Summit, and Hint is the direct primary care. summit within Rosetta Fest. So it was really great to meet some of those physicians. I think they're doing some great things. So we're really excited and looking into a possible ecosystem partnership there with the Hint team. But going back to how do we navigate this world of just so many options in the digital health tech, delivery, DPC space, plus everything that's available through the different health systems and through our employers out there. What do we do with all of these options? How do we prioritize, right? I think those are some of the conversations we can keep having. But I think what at the end of the day, from our perspective and lens is okay, how do you use the best information that is out there to really impact your life in the real time now? How do you get on the road to better health and delay or prevent chronic disease in the future?
Awesome. Well, Lucy, thank you so much for hopping onto the podcast. It was great. Can't wait for the second part where we're going to be comparing nutrition and fitness reports, and then also just hearing about your experiment too, and comparing what the data that you're going to be feeding AI, and then also
My care team
maybe once.
members? Yes.
Yeah, yeah, your care team members just to see what's different. But, excited for that, and, Lucy's contact information is also gonna be in the show notes in case anybody wants to reach out. Thank you so much for listening. Thank you so much for hopping onto the show. Well, sorry, thank the audience. Oh my gosh, towards the end of the day. Thank you so much for hopping onto the show, Lucy. Can't wait to have you back. Thanks everyone for listening. We'll see you all next time.
Looking forward. Have a good one.
Thanks for joining us on the Precision Medicine Made Simple podcast. If this episode inspired you to learn more about your health, please leave us a review and share the podcast with a friend. Your feedback helps spread the word about the power of precision medicine. Remember, taking action today can lead to a healthier tomorrow. See you next time.